So we want to thank Dr. Chopra for presenting this important topic for us today. She will address how caregiver and their loved one can keep safe during this outbreak of coronavirus. The webinar will explain what makes this virus different, his symptoms, mode of spreading, incubation, diagnosis, treatment, and prevention. Um, Dr. Chopra is currently a fellow at Weill Cornell Wright Center of Aging. We will answer all the questions at the end of the presentation. Please add all your questions to the Q&A box. And I know some of you already sent some questions to me. I forwarded it to the doctor, and we're gonna answer some question all the question as much as we can. Again, thank you and welcome. Here you go, doctor. You can start.
Hello, good afternoon, everyone. Thank you so much for your patience. I apologize for the delay starting. So as we all know, the COVID-19, this pandemic has been on the news. It's been a real source of health concern all around the globe. And so today I was hoping to speak with you about what caregivers and older adults need to know about this illness. So what is a coronavirus? So this is a virus that can cause actually 1/4 of the cases of common cold that are out there. The word corona comes from the word crown-like, and that describes these protein spikes on the surface of the virus. And these are the spikes that allow this virus to gain entry into the human body through the respiratory tract. So COVID-19, what does that mean? So it literally means coronavirus disease 2019. This was a term that was coined by the World Health Organization because it does not refer to any geographic location, an animal, or a group of people. So we avoid any kind of stigma associated with it. The virus responsible is called the SARS-CoV-2. So this is the SARS coronavirus. This came out, the last pandemic was back in 2002. And this is SARS-CoV-2 because it's genetically similar to that virus. To be a little more technical, it's a type of beta coronavirus. There's 4 different types. And it's also structurally similar to bat coronaviruses. So really, coronaviruses have been known to circulate amongst animal reservoirs, but every once in a while, they mutate just enough to cause human infection. Some of the coronaviruses that are known to us was the SARS virus back in 2002, that stands for severe acute respiratory syndrome, and also the Middle Eastern respiratory syndrome, or the MERS, that happened in 2012. Both were bat coronaviruses that mutated into an intermediate host and then were able to infect humans. So as we can see here, this coronavirus is thought to have originated in the bats. The intermediate host this time is called a pangolin. This is a cross between an anteater and an antelope. It's a 96% match, and then this is the virus that made the leap into human beings. So what has been the global impact, really? So this virus has now spread to 177 countries worldwide, and over 340,000 infections have been reported. So it has been extremely widespread, and it's been a very rapid spread. So this graph, this is an excellent graph. It's through this group called Osmosis, and really, it's just trying to show us that between January and March 9th, what has been the trend of newly diagnosed cases and the fatality rate. So as you can see, it's been sort of an exponential progression where on March the 9th, there were 109 cases. And today we can see that it's over 340,000 cases. So the case fatality rate that is averaged across all countries and time frames is currently around 3.5%. So let's put that into perspective. When this virus, this outbreak first happened in China, their case fatality rate was around 16%. This was mainly because there was a lot of infections, there were a lot of patients, and there were not enough healthcare resources or testing to keep up with this. Over time, this has gone down significantly where they haven't been seeing any new cases reported in China, so that the case fatality rate has come down dramatically. So this number is basically relative and it's averaged across all countries. So what is the spectrum of illness severity? So the symptoms can be mild, severe, or critical. So mild symptoms would be just upper respiratory cough or a fever. Either they have no pneumonia or very mild pneumonia. Severe symptoms are seen when patients exhibit shortness of breath and they have low oxygen levels. And critical patients are those who undergo respiratory failure, shock, and multi-organ dysfunction. So let's put this into perspective. So 81% of the cases of COVID-19 are actually mild, with about 14% of patients having severe symptoms such as shortness of breath, low oxygen levels, and some sort of infiltrator finding that looks like pneumonia on a chest x-ray or a CAT scan. And only about 5% have critical illness where they're ventilator dependent, they go into septic shock and multi-organ system failure. So what is the mode of spread? So COVID-19 spreads mainly through person-to-person transmission. So we talk about droplet infection. So any patient who is coughing or sneezing is more likely to transmit droplets of infection which contain the virus. This is inhaled into the respiratory tract of another person. And this is the reason why we encourage that people are not within 6 feet of one another, because close contact promotes the spread of the virus. Also touching objects and surfaces and then touching your eyes, mouth, or nose can help the virus spread quite easily. It's also important to remember that they've been finding that this virus remains viable on stainless steel and plastic surfaces for up to 48 to 72 hours. So this means that we should continue to sanitize surfaces that we touch very frequently. What is the incubation period? So this is basically from when the virus infects the host until they start exhibiting symptoms. So most patients become symptomatic on average within 4 to 5 days of infection, and the majority have symptoms within 14 days. Now, some cases in China, they did find that they developed symptoms within 2 days. So it's kind of a broad range where you can become symptomatic anywhere between 2 to 14 days of infection. What are the risk factors of COVID-19? So patients who are, or people who are over the age of 65, residents of nursing homes or long-term care facilities, patients with chronic underlying medical conditions where they could have chronic lung disease in the form of COPD or asthma, coronary artery disease or congestive heart failure, diabetes, immunocompromised state. So if your immune response is blunted, whether you're on or have been in the past on chemotherapy or radiation, if you have chronic kidney disease or cirrhosis of the liver. So we do have a diagnostic test available. Unfortunately, the supply and the demand have not been correlating very much. So we're seeing a lot of new cases, and we're a little bit behind on the testing, but tests are becoming more widely available. And there are more rapid tests available as of this week. So who should be tested? So high-risk exposure that warrants testing is any close contact within 6 feet of a confirmed case of COVID-19, a residence in or travel to areas with high community transmission of COVID-19, if you have attended a group event where COVID-19 cases have been reported, or if a patient has severe lower respiratory tract illness, a severe pneumonia, and no other cause is identified, this warrants COVID-19 testing. What are some of the dreaded complications of this illness? So the main complication is acute respiratory distress syndrome, or ARDS. This is a complication of patients who have severe disease where the lining of the lungs becomes very, very inflamed and prevents oxygenation. So these patients actually require mechanical ventilation and they become ventilator dependent. Other dreaded complications are arrhythmia, cardiac injury, and shock. So we've heard about flattening this COVID-19 curve. What does that really mean? So as we can see, it's on the bottom right here, this is the x-axis here. It's basically the time since first case and the number of cases up here on the y-axis. So what we're trying to say here is that if we do not take all protective measures, we don't take these precautions, the number of cases will skyrocket, and this will overwhelm our healthcare system. So what we want to do is that we want to make sure that while we're taking all the protective measures, the number of cases that are being diagnosed and being treated, there are enough healthcare resources available for them. Now, this would also mean that there would be fewer cases over a longer period of time. So in terms of treatment, so there is no effective targeted treatment at present. There is no vaccine available. However, it is under clinical trials, and it may become available by 2021. The mainstay for treatment is supportive care. This means supporting the patient through the acute illness, whether this means giving them IV fluids, providing oxygenation in the form of ventilator support. There are some medications that are undergoing clinical trial. There's a medication called remdesivir, which was used previously in Ebola patients, which is under a clinical trial right now. And of course, there's the chloroquine azithromycin combination therapy, which they're looking into to see whether or not that is effective in treating the duration or reducing the duration of this illness. But in this case, prevention is key. So what is our approach to management? We really try to recognize early whether there has been potential exposure. Those cases should be immediately isolated, and infection control measures should be in place. So a lot of these infections can be managed at home. If they're very mild, they just have a little bit of a cough and a fever, they're not having any difficulty breathing, they are able to be managed at home. So we're trying to focus on preventing transmission and monitoring for any signs of clinical deterioration. And all frequently touched objects or surfaces should be disinfected frequently. Patients who have more severe symptoms like shortness of breath, or if they're turning blue or they're having changes in their mentation, these patients need to be referred to the hospital immediately. What the most recent recommendations are is that you should not be taking medications like Motrin, Advil, any medications that belong into this non-steroidal anti-inflammatory meds, as well as steroids. So these are not recommended at this time. Now, when should you come out of home isolation? Really, there's a test-based strategy and a non-test-based strategy. If you have been tested positive for COVID-19 and your fever has resolved, you have improved respiratory symptoms, and you have repeat testing, 2 negative tests that are 24 hours apart, that usually means that you've cleared the infection. A non-test-based strategy is if you've had at least 7 days since the onset of symptoms, and at least 3 days have passed since you've completely recovered from the symptoms. Now, this is not definitive, and we would still recommend that you continue social isolation, because we're not really sure as to when we're no longer transmitting the infection, even though we have the symptoms have resolved. So how do we attenuate the risk? So these are measures that we can take around the house. So washing our hands very frequently with soap and water. That's the best way to prevent infection. Wash your hands for at least 20 seconds. If you are using an alcohol-based hand sanitizer, make sure it's at least 60% alcohol. Avoid close contact with any people who are sick. And if you are sick yourself, you need to stay home so that you're not exposing others to this potential infection. Face masks should only be worn if you yourself have symptoms and you're going in to see a healthcare provider, so that you're not exposing them or anyone along the way to your respiratory droplets. However, wearing the mask all the time, if you're asymptomatic, has not been shown to stop the spread or acquiring the illness, because these viruses are extremely small. Always cover your cough or your sneeze with either a tissue or your elbow, and clean and disinfect with household cleaning products any frequently touched objects or surfaces. What are the warning signs that warrant an urgent ED visit or an emergency room visit? Is difficulty breathing or shortness of breath, any persistent pain or pressure in your chest, any new confusion or bluish discoloration of the lips or face. We screen patients if they develop fever, cough, and shortness of breath. We do this over the phone. If they are triaged to go to the emergency room, they should wear a face mask before they get medical attention. And they will always ask whether there has been recent travel or potential exposure. So you should always make a plan before you get sick. So this means if you can call your healthcare provider and ask for refills ahead of time, if you have any medications that you take regularly. Also, caregivers of older patients, we can always make sure that they have enough groceries and household supplies available to last them for the next few weeks, so that this prevents them from having to go into grocery stores and limits exposure. What is social distancing, and what does it mean in older adults? So social distancing just means creating a physical distance between people. So this should never result in social isolation. Social isolation can lead to feelings of depression. It can leave older adults vulnerable to scams, and really that's not the whole point of social distancing. It's just to limit the spread of the infection. How do we prevent social isolation? So you have to continue to communicate, whether it is by phone or if you have video chat applications available. There's multiple. There's FaceTime, Skype, and WhatsApp, as well as Facebook Messenger. So caregivers of older adults can help establish some of these applications so that our patients are able to communicate with their family, which is extremely important. You should always continue to exercise, keep your mind and body healthy. So there are simple exercises that you could do at home, lifting light weights or using a chair to do exercises. And if you have any hobbies, like if there's a book that you've always wanted to read, you can go ahead and do that. This is the right time. If you enjoy gardening as a solitary activity, that can also help to reduce your anxiety levels. And always try to reduce your stress. Try to get enough sleep. That always helps to pass the time, as well as reduce your stress levels. And if there's something you enjoy doing, like cooking, that should also help as well. And there is a lot of media coverage over this pandemic, and that makes absolute sense. But try to filter through news sensationalism and try to pay attention to what's happening locally. This is important because there are a lot of new restrictions in place in terms of curfews as to when you need to be at home, at what time do the grocery stores close. Make sure you get everything done ahead of time and be prepared. So this is extremely important. And of course, there are a lot of resources available. So the CDC website, the cdc.gov/coronavirus, has multiple resources where you can plan ahead and prepare for this from home. And so these are some of the links that you can click on, and how, if there are any frequently asked questions or how to get yourself ready, have a checklist in place. This is a great resource. So I did get a few questions already. I will go ahead and try to answer all of them as much as I can. I think, just one moment, let me just open this up here. Let's see. Here we go. So the first question was from Day. How does the severity of this virus compare with the annual flu viruses in the US? And how much of all this is hype? When I was in Florida, the media hyped every hurricane warning, making it difficult to know when a real hurricane disaster was imminent. That's a great question. So the seasonal influenza, This is a virus that we are well versed with. It has been around for many, many years. It has very predictable trends. And really the mortality rate or the percentage of severe cases is about 0.1% per year. And we also know when the number of cases spike, and we have a vaccine available in this case. So the main thing with the COVID-19 is that it has a very high mortality rate. In places like Italy and South Korea and China, the case fatality rates were up to 14 to 17%. It is a novel coronavirus. We do not have a lot of data available. There is no vaccine in place right now. So it has claimed many thousands of lives worldwide. So it is definitely a real threat, and we should do everything that we can to make sure that we try to get ahead of this situation. The next question was about is in Hashimoto's disease, which is an autoimmune disease, is a 68-year-old senior in the high-risk category. It's actually a little too early to say. We do not have a lot of data specifically for Hashimoto's disease. There are patients who do have certain autoimmune conditions who are on immunosuppressants, which tend to blunt their immune system. Now, these patients may be at higher risk of having a more severe illness. However, it is too early to say. We do not have the data available to say whether or not this particular illness puts you at a higher threat level. The next question was from Martha. How long can the virus live on furniture and other surfaces? There's a really great article in the New England Journal of Medicine where they talk about different materials. So on plastic, the virus can last up to 72 hours. On stainless steel, up to 48 hours. On cardboard, it can last up to 24 hours, and on copper surfaces, up to 4 hours. So what does this mean? It just really means that if you are touching objects and surfaces very frequently, make sure that you use your household sanitizing means to clean maybe once or twice a day. The next part of the question was, does the virus enter the body only through the eyes, nose, or mouth, or also skin surfaces? The virus is known to infect through the mucosal or the respiratory surfaces. That would be the nose, the eyes, and the mouth. I have not seen any data to suggest that it enters through the skin surface. So the T-zone of the face is the high-risk area. So we always have to make sure not only do we wash our hands frequently, we avoid touching these areas altogether. Are there any theories about why kids tend not to be affected? There are only theories. One of the theories is that this virus causes a major inflammatory response in middle-aged and older adults. That's one of the main the pathophysiologic mechanisms behind this acute respiratory distress syndrome, which leads to patients being on ventilators. Now, children have developing immune systems, so they may not generate a massive inflammatory response. But really, it's hard to say. We do not have enough evidence to support this, but we do see that amongst the 72,000 cases in China, the number of patients under the age of 10 years was only about 1%, and they were less likely to have any severe illness. And the last part of the question was, I've heard that a treatment for HIV, lopinavir and ritonavir, under the name Kaletra, can help with COVID-19. Would a PrEP or drug such as Truvada prevent HIV and have some effect on preventing this new virus? So I just read, actually, there was an article, again, I think in the New England Journal of Medicine. They did study Kaletra in very sick, very ill ICU patients, and they did not find any difference in mortality and morbidity with this medication. Now, in the future, they might test it on the mild to moderate disease category and see if there's any changes, but it has not shown to benefit these patients at all. The next question, if a person tests positive with the virus but does not get sick, for how long is this person infectious or able to transmit the virus to others? Again, amongst some of the Chinese patients, they did nasal and throat swabs on these patients who had tested positive for COVID. And they found that up to 10 days, they were still shedding high levels of virus in their, more in the nose than in the throat. So it's really unclear as to how long they can be passing this virus to others. So because we don't have that information, it's still better to continue social distancing and continue to maintain the measures that we talked about just a little bit earlier. Next question is from Martha Ferry. I take walks every day for exercise as a way to see something other than the four walls of my apartment. Is there anything wrong with that as long as I stay away from other people? I don't believe that there's anything wrong as long as you continue to social distance, keep at least 6 feet away from others, avoid gathering in public parks with other people. And then, yes, you should continue to exercise, keep your mind and body healthy. The next question is from Kathleen. I apologize if I'm mispronouncing this. I have a question I do not understand the answer to. If several seniors who do not have the virus, why is it recommended that we stay apart? If we do not have the virus, why do people stay 6 feet apart or even get together with few people to socialize, like watch movies, play cards, or something? So the thing is, with this virus, it's known to have asymptomatic carriers. And it's really hard to tell because there's not enough testing available who has the virus and who doesn't. And unfortunately, the fatality rate and the number of severe illness cases is very high amongst the population above the age of 65. So it's always better to stay cautious and continue to practice social distancing. You still can video conference with your friends. Like I said, this is not about causing social isolation, but just social distancing. And the last question was, other than hand washing, what other measures can I take? This is from Cheryl. How do I keep myself protected from the virus? And so other than hand washing, which is excellent, try to sanitize surfaces around the house with household sanitizers. Do not touch the T-zone of your face. Maintain social distancing, and always have a plan, whether it's getting medication refills, stocking up on groceries and household supplies, and always have an emergency contact with this sort of contingency plan. So what should happen if you do develop symptoms? Okay, let's see. So what words should one use when explaining the current virus situation with a dementia patient? So I think keeping it very simple, that this is a virus that causes that can cause a cough, a fever, and some difficulty breathing. And if any of these symptoms should present, you need to call your healthcare provider and make sure that you run this by them, and they will decide whether or not your symptoms are severe enough to warrant a visit to the hospital. A lot of times there are video visits available as well with your healthcare provider so that they can take a look at you and see how you're doing. Does heat kill the virus? I'm thinking about purchasing food from restaurants. Yes, as long as you make sure that the food that you're eating is, very hot, freshly prepared. There's always a risk in between handling, but heat should help with making sure that the food that you eat is not containing the virus. How much risk does being pre-diabetic add? Now, I don't have exact numbers as to how much risk this would add, but just making sure, again, that you maintain all the precautions that we talked about. How big a risk does having A positive blood type add? I recently did read that having A positive blood type can predispose you to the virus, but I'm not 100% sure as to what the pathophysiology is. I'm not sure if Dr. Reed, if you have any information about this. Dr. Reed, are you here?
I'm not sure if she's here. I don't think she can access. But
Okay.
if we do have the answer, we can always oh, she if the doctor, if you can type the question, I mean the answer, I can read it for you, but I don't think we can hear from, yeah, no, we can't.
Okay.
What's
Is
the doctor's first name?
Dr. Carey, Cary, Carrington.
Oh, okay. I see Carrie Reed
Yeah,
listed
that's
here.
him.
I can add them on as a panelist if they are okay with that. Um, so bear with me. I'm gonna allow them to talk
Sure.
and see if they wish to speak. They can. Dr. Carrie Reed, you are
Yes,
open to
I'm
talk.
on. Could you repeat the question, please?
Whether having type A blood
Uh,
type adds to risk. How big a risk is it?
yeah, I agree with you. I don't think we know it. We're still in the early phases of understanding what are the factors that really people reduce their chances of getting this and increase health. Our hope is soon, with more information coming from both Italy and China, we'll have firmer answers, but right now we don't.
Right. Thank you, Dr. Reed. And then it says Governor Cuomo has suggested that seniors over the age of 70 should always wear masks. As I mentioned earlier, if you do not have any symptoms, you do not need to wear the mask because transmission is still possible even without wearing the mask. These are the surgical masks that you see every day. The N95 respirator masks, they may limit the spread of the virus, but if you do not have any active symptoms, it is not recommended that you wear it. There is a severe shortage, in fact, of personal protective equipment for healthcare workers who are actively seeing patients with COVID-19 every day. So if you do not have symptoms, you are staying at home, you are practicing social distancing, you don't actually need to wear a mask. Let's see, what are some other questions?
Dr. Chopra, just to kind of throw it
Yeah.
out there, because we are doing this live on YouTube, we do have a few questions on our YouTube channel as well.
Okay,
And I
go
know
for
we're
it.
getting a long list here. So I would like to just, if it's okay with you, to throw in a few questions from YouTube so we're kind of balancing it out between the webinar and the YouTube channel.
Absolutely. Mm-hmm.
All right, so we have one here. Are you allowed to travel out of state if we don't have the virus?
I think travel anywhere right now is basically not recommended. There are cases all over the United States, at least for air travel, and they're suggesting do not travel out of state or basically anywhere. Try to limit all your exposure as much as possible because we really don't know who is a carrier at this point and who isn't. So even if you do not have symptoms, you may be carrying the virus, and that can still allow for the potential of spreading the virus.
Thank you. Another one we have here is, I see a lot of people on social media making masks at home out of cotton material and some sort of filtering material such as furnace filter linings. Is this something that has been proven effective?
As far as I know, that these measures are not proven effective. I believe that the CDC the other day had mentioned using basically anything, so things like scarves to cover the face, but that was more for healthcare workers who are, because they're experiencing such severe shortages of personal protective equipment, they were basically saying that you can use these measures to cover your mouth and your nose. However, there's no proven benefit of these materials. So I cannot say that this is going to prevent the spread of transmission at this point because it has not been studied.
Thank you. Another one is, if a patient who is hospitalized has had the pneumonia vaccination, will it help them?
Yeah, so this is an excellent question. The pneumonia vaccine is basically prevents from the bacterial infection caused by strep pneumoniae. This is a bacteria. This COVID-19 is a virus, so it does not directly protect against COVID-19. However, a lot of patients who do have COVID-19 can potentially develop a super added infection or a bacterial infection that can cause pneumonia, which can worsen the severity of their illness. So in that regard, it can help prevent the development of this bacterial infection causing pneumonia.
Thank you. Once you recover from the coronavirus, are you immune? Can you get it again?
So again, this is a novel coronavirus. We do not have a lot of data that supports whether or not the immunity that you get from one infection of COVID-19 protects you and for how long. We really don't know if this is lifelong protection that you would have, or would it just protect you from this particular strain and then there might be mutations down the line. So we do not have the data available to say whether or not you could get another infection with coronavirus.
Thank you. If you have groceries delivered, how should you handle receiving them?
I think that you can still have things delivered because you still need groceries and things. And if you're trying to limit your exposure to grocery stores and people, having food delivery is an alternative option. Just make sure that you are frequently washing your hands when you do get the groceries. Make sure you wash them thoroughly with hot water. And I think that could help to limit the spread. This virus is known to last on certain surfaces. So if you are getting any stainless steel or plastic or anything like that, just wipe off the surface of the box itself. And then you can go from there just with household cleaning supplies and sanitizing wipes. But the groceries themselves just should be washed very thoroughly with warm water.
Bringing up surfaces, someone actually asked, can you repeat how long a virus lives on different surfaces once more?
Of course. So this was basically a study that was done. This is in the New England Journal of Medicine. Again, these are some of the cases that they've seen in China. So they actually tried to aerosolize the virus and see how long it lasts on certain surfaces. So plastic was up to 72 hours, stainless steel up to 48 hours. They didn't find any virus after 4 hours on copper surfaces, and on cardboard up to 24 hours.
Thank you. Some people are wondering, is it safe to go to family members' houses that you've frequently been in contact with?
So again, it depends on age as well. So if you are living even in an intergenerational household where you have multiple family members of different ages and generations living under the same household, please make sure that patients who are or people who are older than the age of 65, they have their own space, even their own bathroom. We would not recommend visiting any family members, even if you have been seeing them frequently, just because we're absolutely not sure as to who's a carrier and who isn't. Because even if they're not displaying any symptoms, they may still be carrying the virus. So we would limit any sort of social contact, even with family members. But that is not to say that you cannot still video conference with them and speak as much as possible.
All right, thank you. There are many more questions, but we can flip back over to the ones through the Q&A to get some of these answered as well.
If you are recovering from another virus, are you more vulnerable to getting coronavirus? It's hard to say. Sometimes we forget, because of this pandemic, we often forget that there are other viruses, and the flu is actually very, very common. And it may potentially allow you to be more vulnerable to development of coronavirus. So definitely, if you are getting over one viral infection, please make sure you stay home. Do not go outside. Do not go to work. And just limit your contact with the outside world for now, because you may be vulnerable to getting the COVID-19 virus as well.
Dr. Chopra, can you answer the question about dementia patient?
How to explain the current virus to a dementia patient?
Yes.
Right. So in patients who do have dementia and very advanced dementia, in certain cases, you may have to keep reinforcing this, that there is this current virus that is causing just basically breathing problems and cough and fever. When to recognize these symptoms. It really, it's the caregivers of these patients who should also receive education about what are the signs that to recognize and what warrants an emergency room visit versus when to call your doctor, and make sure that there's at least a video visit that's set up for them. And just making sure that, you know, they don't touch their face and then they will keep their hands clean, keep their hands washed. And the caregivers of these patients should make sure that any frequently touched objects or surfaces are sanitized. They should be explained to why they need to be practicing social distancing, because a lot of dementia patients may not understand what is the need for social distancing, but always making sure that they have that avenue available to speak with their family members over video chat. Their caregiver should always have that avenue open for them so that they don't feel fearful, confused, and they don't have additional anxiety that's brought on by this social distancing strategy.
Oh, great. One question is about is it safe to eat fruit? I think a lot of people want to stay healthy and then are worried about how if we still can eat those type of things. Can you answer that too?
Yeah, so in terms of eating fruits, I can understand. Just making sure that if you are eating fruits, make sure that they're thoroughly washed. Try to use hot water when you're washing the fruits. If they can be peeled, that's good too, but I'm not sure if I haven't seen any recommendations, at least on the CDC website, as to not eating fruits at all. It's just about maintaining that hygiene, hand washing, and limiting the spread of the virus.
Another question is just can you just talk a little bit about pregnancy and the virus before this is over?
In terms of pregnancy, yes, patients who women who are pregnant should definitely maintain all of these preventive measures. The actual, I'm not sure if I can say that they're at a higher risk or they can contract the virus more frequently than patients who are not pregnant. However, the severity of the illness can vary during pregnancy. So making sure that you take all available precautions during the pregnancy would be best. That would be my recommendation. I'm not sure if Dr. Reed, you've heard anything else about this?
Again, I think we don't have enough results to support the idea that women who are pregnant are at increased risk.
Right. Does eating sugar affect one's possibility in contracting the virus? I don't believe that eating sugar should increase the risk. However, if you are diabetic and you are on medication for it, please make sure you're taking all available precautions, making sure your blood sugars are well controlled, because uncontrolled diabetes definitely leads to more of an immunocompromised state where your immune response is blunted. And you would not, this is something that could potentially worsen the course of illness if you do contract COVID-19.
Doctor, I have a quick question regarding home care workers who provide essential services to older adults. Are they supposed to continue to provide care? So what are the measures they can take?
I think that home care workers should definitely maintain hand hygiene. making sure that if they are delivering care, they are using protective equipment. If the person that they're caring for is exhibiting active symptoms, to make sure that they alert the family members and speak with a healthcare provider as to whether or not they need to come in for testing, basically to limit their own risk as well as the risk of transmission to the healthcare workers. So yes, they may continue working. However, if they develop symptoms, they should notify the patients as well as the family members to let them know that they will not be coming in. If you have active symptoms, you should not be taking care of older adults because they are the most vulnerable for this infection. So if you exhibit symptoms, do not continue to work. It's not about toughing it out and still going into work. You have to stay home.
Thank you, doctor. I'm not sure, Dr. Reed, do you want to say something before we end the call? Kevin, can you unmute Dr. Reed, please?
I want to thank Dr. Chopra for a very expert and outstanding presentation. I do want to add one comment to the last question, which is our hope is with increased testing, we will be able to begin testing in the community. Many people develop symptoms. I get calls all the time from patients at home who have care workers, and this question comes up. Right now, the only thing that we can do it become very symptomatic is to suggest that they go to the emergency room. Again, our hope is that when more tests become available, we will be able to begin testing at home to not only rule in, but rule out infections for people, to reassure not only family members, but workers as well. But again, kudos to Dr. Chopra for a job well done.
Oh, thank you so much, Dr. Reed. And I'd really like to acknowledge Dr. Reed, who's my attending physician in the Department of Geriatrics at Cornell Hospital. Thank you so much for all your guidance. I'd also like to thank Ms. Michelle Arnaud and Ms. Shana Jacques at the PSS Circle of Care for making this webinar possible. I thank you very much for this opportunity.
Thank you all. Thank you, Dr. Reed and Dr. Chopra. Thank you, everybody, for participating on this webinar today. This webinar is being recorded, so if you missed anything, you can go back to our website, pssusa.org. You can see and watch it again. I just want to say, everybody, like you doctor said, to stay home and stay healthy. If you have any question or any other questions, you can still reach out to us. Also, we do have a lot of educational training that had been recorded prior to that. Please visit us on our website, pssusa.org. And for people that in need of any type of support or any type of support group, we do have them available online and also in all our 5 at a support group via telechat. If you need anything, you can reach out to me. My email is sjack@pssusa.org. Jack is JACQUES. Again, thank you, everyone, and stay home and stay safe.
Thank you, Shana, and thank you, everyone, for your excellent questions and for tuning in.